Pathogenesis of SLE. It itself is a huge topic, but I will spend some time with one slide in a diagram which explains everything, how SLE starts. So we have predisposing factors in which lot of genetic factors are there. Like if somebody has deficiencies of C1q, CT, C2 or C4, these are the complement proteins. If somebody is deficient in these proteins, they are at increased risk of developing lupus. If somebody has TREX1 mutation, which affects the DNA degradation, then it is also a risk factor for lupus. Other HLA related and genetic predisposition are HLA DRB1, DR3, DQA2, etc. Then there are certain genes which are involved in the interferon production. Due to this, there is enhanced innate immunity and self-reactivity. These are those genes. Then there are genes which alter the function of B cells and T cells, and these are those genes like BANK1, STAT4, etc. Then there are genes which predispose to lupus nephritis. So many genetic factors are there. But when we see a patient in clinic, we don't start evaluating or thinking on genetic lines because treatment is decided by the clinical manifestation and not the genetic defect with which the patient has. Moreover, some of these gene-related lupus start early in the childhood and they are predominantly treated by a pediatric rheumatologist. Even in those cases, finding out a genetic mutation doesn't change the treatment plan. So these are more for the academic purpose that these genetic mutations or genetic predispositions can affect lupus, but the treatment is not based upon them. Then there are some environmental and micro environment factors like exposure to UV light. Smoking is a very, very important environmental risk factor. Exposure to crystalline silica, EBV infections, CMV infections, so many viral infections have been known to predispose to lupus, but they haven't been proven because these infections are so common and so universal that it is difficult to say that these lead to lupus or SLE. And female hormones or gender bias is more predisposing females to most of the autoimmune diseases. Then there are epigenetic changes. Epigenetic change means once the genetic code has been transcribed and protein formation is there, after the change in the genetic code, which is not passed on to the generations. So hypomethylation of DNA, it basically alters the genetic protein synthesis and subsequently affects the immune response, histone modification, microRNA, so on and so forth. All these are very active fields of research right now, so that if we can correct that basic defect in the immune response, probably we can achieve cure for this disease, which is not true right now. So once these genetic or environmental factors are there is an abnormal immune response. This abnormal immune response leads on to formation of lot of antibodies, in which anti-nuclear antibody or ANA is the most prominent one. And this autoantibody reacts to so many self tissues and causes damage in various areas, which can be resultant of direct damage by the antibodies or by the complement mediated damage. So patient who develops clinical symptoms can have fever, rash, joint pain, kidney inflammation leading to nephritis, and severe patients can have more severe manifestations affecting heart, lungs, brain, etc. So we are going to go into detail of all the clinical manifestations, how to diagnose, how to approach a patient of lupus, and how to treat. What are the guidelines? So this is how basically pathogenesis happens, from predisposing factors to abnormal immune response to inflammation, and later on that inflammation leading to damage in the particular organ.